The stomach channel. Point locations. Stomach 1. When the eyes are looking straight forward, the point is located directly below the pupil, between the eyeball and the infraorbital ridge. Stomach 2. Below stomach 1 in the depression at the infraorbital foramen. Stomach 3. Located directly below stomach 2 at the level of the border of the alanasi, on the lateral side of the nasolabial groove. Stomach 4. Located lateral to the corner of the mouth, directly below stomach 3. Stomach 5. On the anterior border of the attached portion of M. masseter in the groove-like depression appearing when the cheek is bulged. Stomach 6. 1 finger's breadth anterior and superior to the lower angle of the mandible, where M. masseter attaches at the prominence of the muscle. Stomach 7. At the lower border of the zygomatic arch, in the depression anterior to the condyloid process of the mandible. Stomach 8. 0.5 cun within the anterior hairline at the corner of the forehead. 4.5 cun lateral to do 24. Stomach 9. Level with the tip of Adam's apple, just at the course of the common carotid artery, on the anterior border of MSCM. Stomach 10. At the midpoint of the line joining stomach 9 and stomach 11 on the anterior border of MSCM. Stomach 11. At the superior border of the sternal extremity of the clavicle, between the sternal head and the clavicular head of SCM. Stomach 12. In the midpoint of the supraclavicular fossa, 4 cun lateral to the Ren meridian. Stomach 13. At the lower border of the middle of the clavicle, 4 cun lateral to the Ren meridian. Stomach 14. In the first intercostal space, 4 cun lateral to the Ren meridian. Stomach 15. In the second intercostal space, 4 cun lateral to the Ren meridian. Stomach 16. In the third intercostal space, 4 cun lateral to the Ren meridian. Stomach 17. In the fourth intercostal space, 4 cun lateral to the Ren meridian. Stomach 18. In the fifth intercostal space, 4 cun lateral to the Ren meridian. Stomach 19. 6 cun above the umbilicus, 2 cun lateral to the Ren 14. Stomach 20. 5 cun above umbilicus, 2 cun lateral to Ren 13. Stomach 21. 4 cun above umbilicus, 2 cun lateral to Ren 12. Stomach 22. 3 cun above the umbilicus, 2 cun lateral to Ren 11. Stomach 23. 2 cun above umbilicus, 2 cun lateral to Ren 10. Stomach 24. 1 cun above umbilicus, 2 cun lateral to Ren 9. Stomach 25. 2 cun lateral to the center of the umbilicus. Stomach 26. 1 cun below the umbilicus, 2 cun lateral to Ren 7. Stomach 27. 2 cun below umbilicus, 2 cun lateral to Ren 5. Stomach 8. 3 cun below umbilicus, 2 cun lateral to Ren 4. Stomach 29. 4 cun below umbilicus, 2 cun lateral to Ren 3. Stomach 30. 5 cun below umbilicus, 2 cun lateral to Ren 2. Stomach 31. Located at the lower border of the symphysis pubis, in the depression on the lateral side of M. sartorius when the thigh is flexed. Stomach 32. 6 ton above the lateral superior border of the patella in M. rectus femoris. Stomach 33. 3 ton above the lateral superior border of the patella. Stomach 34. When the knee is flexed, the point is 2 ton above the lateral superior border of the patella. Stomach 35. When the knee is flexed, the point is at the lower border of the patella in the depression lateral to the patellar ligament. Stomach 36. 3 ton below stomach 35, 1 finger's breadth from the anterior crest of the tibia in M. tibialis anterior. Stomach 37. 3 ton below stomach 36, 1 finger's breadth from the anterior crest of the tibia in M. tibialis anterior. Stomach 38. 3 ton below stomach 37, midway between stomach 35 and stomach 41. Stomach 39. 3 ton below stomach 37, 1 finger's breadth from the anterior crest of the tibia in M. tibialis anterior. Stomach 40. 8 ton superior to the external malleolus, about 1 finger's breadth lateral to stomach 38. Stomach 41. On the transverse crease of the ankle joint in the depression between the tendon of M. extensor digitorium longus and hallucis longus. Stomach 42. At the highest point of the dorsum, in the depression between the second and third metatarsal bones at the cuneiform bone. Stomach 43. In the depression distal to the junction of the second and third metatarsal bones. Stomach 44. Proximal to the web margins between the second and third toes, in the depression distal and lateral to the second metatarsodigital joint. Stomach 45. On the lateral side of the second toe, 0.1 ton posterior to the corner of the nail.